This is part of a speaker series trying to get information into our community, the arts community, about the facts about the vaccine today. I want to welcome our attendees. We have a small but mighty audience. This is being recorded, and so this will be posted online and distributed quite broadly. So for any of you who don't want to be seen, feel free to keep your videos off. You can find out more about our disaster program at ready.haatx.com. That's ready.haatx.com. And with that, we'll dive into the vaccine info we're here for today and Dr. Hotez's expertise. If any of you have questions for the doctor, please use the Q&A function at the bottom of the screen. It's at the bottom right in the black bar. We'll make sure to get as many questions answered as possible. We will start with a presentation, but let me begin by introducing the esteemed Peter Hotez, MD, PhD. He is Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine. He is also there the co-director of the Texas Children's Center for Vaccine Development and Texas Children's Hospital Endowed Chair of Tropical Pediatrics. I am going to skip through the about 12 additional fellowships, scholarships, appointments, professorships the man has throughout Texas and I believe throughout the world, and say that as an autism parent and a vaccine scientist, he has been an incredible advocate to defend vaccines against the anti-vax movement. He's received the award for leadership for advocacy for vaccines from the American Society of Tropical Medicine and Hygiene, a very well-deserved award. And he's here today to share his expert understanding and perspective and knowledge about the COVID-19 vaccination. So good morning, Dr. Hotez. I will hand it off to you.
Well, thank you so much. It's an honor to be here and to do something on behalf of your amazing organization. Why don't I can start out with a few slides if you'd like, and then leave it up to Q&A. Should we do that?
Yeah, let's do that.
I'll try to minimize the number of PowerPoint slides. I know in this COVID era, no one's clamoring for more PowerPoint slides. I haven't seen that happen yet, but let me make a few comments here. And then we'll open it up for questions just to provide some background on some of the points that I think are worth making. Okay. So first of all, one of the things I like to point out is coronavirus vaccines are not really new. And, one of the things that's out there is how can these COVID vaccines be for real, because they popped out of nowhere in the period of a few weeks. And I always like to make the point that, our group at Texas Children's and Baylor has been working on coronavirus vaccines for a decade. Originally for SARS, the original SARS that came out of southern China in 2003, and then MERS. And all of that work went into the COVID-19 vaccines and Operation Warp Speed. So the idea that they arose out of a few weeks or a few months is not really true. It's the CEOs tended to spectacularize their accomplishments in the press releases, which, remember, are not for you or for me, but for the shareholders. And that led to that false impression. But in fact, this builds on a decade-long research and development program. This is a picture of the coronavirus with faux color imaging. And these little pink flowers are actually the spike protein of the virus, which is a trimeric protein that binds to our host tissues. And all of the vaccines that you've been hearing about, whether it's the mRNA vaccines from Pfizer, this is a slide from Tony Fauci, from all of the mRNA vaccines from Pfizer and Moderna, or the adenovirus-based vaccines from AstraZeneca, Oxford, and J&J, and our recombinant protein vaccine that we're accelerating in India, or the new Novavax vaccine, they all work by presenting the spike protein to the immune system and measuring immune responses. And the idea behind it is that these vaccines were shown in phase 3 trials to prevent you from going to the hospital, preventing you from going to the ICU, and preventing you from dying. And the reason is because they induce those virus-neutralizing antibodies that bind to the spike protein and prevent the spike protein from attaching. The other recent good news is that there's now new evidence coming out of Israel and Scotland and a couple of other places, now that the vaccines are in use, that they're doing something else, which we kind of suspected, but now we know it to be true, that they're also stopping virus shedding from the nose and mouth. And what that means is it'll stop asymptomatic transmission. So the reason you get asymptomatic transmission is because people who are infected are still shedding a lot of virus from their nose and mouth and when they speak. And in fact, what's happening now when you get vaccinated, the antibody is leaching into the mucous membranes of your nose and mouth and stopping the virus there. And that's really good because what it means is that if you get a high level of vaccine coverage, originally we said 60 to 80%, but now I think it's going to be higher because of the variants, which we'll talk about in a minute. You'll actually stop virus transmission, which is fantastic. It means I think we can vaccinate our way out of this epidemic in the United States by the summer. And for that, we're going to need several vaccines. The mRNA vaccines are not going to cut it. We're going to need more. We'll also certainly have to vaccinate adolescents, which will happen by the fall, I think. So by the fall, I think we'll have uh, uh, teenagers vaccinated. So junior high schools and high schools, both pupils and teachers and staff could be vaccinated. And we're going to have to step up our level of communications as well. And so here are the different waves of vaccines coming along. First with the two mRNA vaccines last year. Now we have the J&J vaccine, and we can expect these two others, the Novavax particle and the AstraZeneca Oxford, soon to be released through emergency use authorization. Here's ours, which we're really focusing more on low and middle income countries, but we're in discussions about a strategy of bringing that along in the United States as well. And we'll talk about the advantages of that. And the question I'm often asked is, hey, doc, which one should I wait for? And the answer is don't wait. Because they all work the same way, induce virus neutralizing antibodies. They all have pretty high levels of protective immunity. One of the things that we don't know for any of them is the durability of protection, how long they're going to protect for. And remember, there's a high likelihood that everyone's going to get an additional boost of their current vaccines either later on this year or next year. So that don't be surprised if the two mRNA vaccines become, which are 2 doses, become a 3-dose vaccine because you'll get that boost down the line. And the J&J vaccine, which is single dose, don't be surprised if you get a second boost. And the reason is having that extra boost will give you even higher levels of virus neutralizing antibodies, more durability of protection, and that boost will be slightly different. It'll be slightly altered to be specific for one of the new variants that are arising. And here are the variants of concern that we call them. They go by different names. VOCs, variants of concerns, spike gene target failure mutants, and most of them, the ones that we worry about, have an amino acid substitution in a 501 position. I'll tell you what that means in a minute. And the big ones that are coming out right now are the ones out of the UK, spreading across Europe, and now in the US here in a big way. So the one that we have to worry about most in the US is the B117 variant that's now spreading across the US and accelerating here in Texas in a big way. The South African variant is of concern down the line. It's not, I don't think it's going to be a big concern here in the US, at least for the foreseeable future, but it's going to be a huge problem in sub-Saharan Africa. And there's a Brazil variant called the P1, which again, I don't think is going to be a big player in the U.S. For this year, but down the line it will be, and that's why we're going to need additional boost the end of this year, next year, to worry about these guys. Right now, all of the vaccines that we have work really well against the B117 variant from the UK, so that's good news. And you're probably saying, well, what's the story about that? I know you're not molecular biologists, but it's helpful, I think, for people to visualize it. So this is that trimer spike protein. That trimer has 3 receptor binding domains, of which anytime one of them lifts up like a flip-top lid and binds to our host receptor, and that's how the virus gets into the tissue. The UK variant has that amino acid substitution, which is an aromatic amino acid substitution, which allows the spike to bind tighter to the host receptor. And that's likely translates into the fact that it's more highly transmissible. And now, unfortunately, a paper released this week from Nature magazine showing its higher lethality as well, and higher rates of hospitalization, the study coming from Denmark. So that little change in chemistry with that mutation is causing all of this havoc with the B117 variant accelerating. Again, the good news is all of the vaccines that we have worked just as well against the UK variant, we think, as the original parent lineages. The bad news is we're in a race. We're in a race to try to vaccinate ahead of this UK variant. A more ominous one, but one not yet a big factor in the U.S. is the South African and the Brazil variant, and the reason is there's an extra amino acid substitution, and that means that the antibodies, the virus neutralizing antibodies to the vaccines for South Africa and Brazil, likely don't seem to work as well. And we actually have some data about that from the Novavax and J&J vaccine that was tested in South Africa, and you can see the levels of protective immunity decline from 90% from the Novavax vaccine to 50 to 60%. ZA means South Africa, 72% from the J&J down to 57%. So we are seeing declines, and therefore it's still partially protective, but we're likely going to have to see some boosts down the line. And we're particularly focusing on this because our group, our Texas Children's Center for Vaccine Development, is very much focused on global health vaccines. So we've been making vaccines for diseases of the poor like schistosomiasis and Chagas disease. And then about a decade ago, we adopted a coronavirus vaccine program because at the time, nobody cared much about coronavirus vaccines. So we partnered with the Galveston National Laboratory and the New York Blood Center and started preparing vaccines for this problem, this, that where it's impossible to do social distancing in the big mega or urban centers in Kinshasa and Lagos in Nigeria, or Kinshasa and DRC, or you name it, Dhaka and Bangladesh, et cetera. And so our partnership is with through Texas Children's Hospital. It's called the Center for Vaccine Development. It's co-headed by myself and Mary Elena Batazzi, my science partner for the last 20 years, and it's part of our National School of Tropical Medicine. And this is done in collaboration with PATH. That's not a household word, but that is an organization that led the development of the meningococcal A vaccine for Africa and the malaria vaccine for Africa. And Baylor recently licensed this to Biological E, which is one of the big vaccine producers in India. And now they're scaling up production of this. We're completing phase 2 now in 5 sites in India. It's a very simple vaccine. It's a recombinant protein vaccine made in yeast. And the reason that's relevant is that yeast technology has been used to make hepatitis B vaccine for the last 30 years. So it's a well-established safety record. It's on alum, and together with this molecule called CpG from Dynavax, and now it's being scaled, great protection in non-human primates, and you can make a bucket of it. So Biological E in India is producing 1.2 billion doses, simple refrigeration, 40-year track record of safety, and this technology has been used in kids for 40 years. So I think parents will find it easy to accept for kids and in pregnancy, and it's cheap. We think we could do this for $1.50 a dose, which will be about the most inexpensive of all of the COVID-19 vaccines, and fill that gap for low and middle income countries. Now, just to finish my remarks, the other big activity that when I got my MD and PhD in New York, in the 1980s, I never thought I'd be involved with is this stuff, fighting these anti-vaccine movements. And I got really involved in this because of a very aggressive anti-vaccine movement here in Texas that stimulated me to write. I like to write books now, and one of them that I wrote is called Vaccines Did Not Cause Rachel's Autism, to debunk the initial assertions from the anti-vaccine lobby. And now I have a new book that just came out called Preventing the Next Pandemic, and I've been writing articles about this rise in the anti-science. Let me just give you the brief history of it, because it's kind of interesting. It started more than 23 years ago when Andrew Wakefield and his colleagues wrote a fake paper that was published in The Lancet claiming that the measles, mumps, rubella vaccine, the live virus in the measles, mumps, rubella vaccine, had the ability to replicate in the colon. And then somehow that led to autism, or at the time they called it pervasive developmental disorder. It was debunked by an investigative journalist from the Sunday Times of London, Brian Deere, who then wrote a series of articles in the British Medical Journal, and it was retracted, but it still stimulated this movement across Europe. And as vaccine coverage drops, measles is often the first one you see. So we started seeing 80,000 measles cases in 2018, 90,000 in 2019. so much so that the WHO, the World Health Organization, listed measles as a top 10 global health threat for 2019. And unfortunately, it took hold in the US. And it started in an interesting way, and that was this initial assertion that the MMR vaccine caused autism, and then others got into this. So Robert F. Kennedy Jr. Became a lead anti-vaccine activist. He said, no, it's not the MMR vaccine, it's the thimerosal preservative in vaccine. Then it became spacing vaccines too close together, then alumin vaccine. So they kept on moving the goalpost. It kept, every time you would debunk it, they would come up with a new assertion. And then they started switching over to the cervical cancer vaccine, HPV vaccine. They claimed it caused infertility and autoimmunity with no evidence. And then they're switching to now chronic illness. And I got involved in this being here in Texas because so many kids were being exempted out of vaccinations by their parents. So that's when I wrote this book called Vaccines Did Not Cause Rachel's Autism, because I have 4 adult kids, and Rachel is my youngest daughter who still lives with us. She has autism and intellectual disabilities, special needs. That's me with Rachel, and that's Velvet Taco on Westheimer in Montrose. So we live in the Montrose area, and I write a lot about Montrose, and it's been tough because the anti-vaccine people are pretty aggressive. So Robert F. Kennedy Jr. publicly calls me on his Instagram account the OG villain, which I had to look up. It means the original gangster villain. So you've invited John, you've invited the original gangster villain to address your group today. I hope you know that. And then I go into what autism is and how it begins in early fetal brain development. I described the fact that we did at Baylor Genetics, we did whole exome sequencing on Rachel and my wife Ann and I, and identifying the genes that are involved in autism. And a lot of that work goes on at Baylor as well, with Huda Zogby's group at the Neurological Research Institute and others. And so while debunking the autism stuff, what happened was, so many parents were opting their kids out of getting vaccinated, especially in Southern California and Orange County. That became a big anti-vaccine stronghold by 2013. This precipitated a terrible measles epidemic in 2014 and 2015 in Orange County. And that caused the California legislature to say, you know what, this is craziness. We've allowed vaccine exemptions for too long. We're going to stop it. And this then re-energized the anti-vaccine movement, which had been floundering in part because myself and others had been debunking the autism link. So they reinvented themselves as a political movement, and under this banner of health freedom or medical freedom. And they found a great home here in Texas, where they aligned themselves with the Republican Tea Party. And the number of kids getting opted out of vaccinations really accelerated. Texas created its own anti-vaccine political action committee PAC called Texans for Vaccine Choice. And you get the sense of the word choice. All these PACs have the word choice or freedom in it. And basically, this is unwarranted government interference. And this was a way the anti-vaccine movement re-energized. It's particularly strong in the Austin area and up in some of the North Texas counties, and it's causing a lot of damage, particularly in 2020, because those same health freedom groups then glommed on protests against masks and social distancing, and it really became a full-on anti-science movement that began in Texas and then quickly spread nationally. And so this is what I've been spending a lot of time fighting right now, these anti-science groups. And with the COVID-19 vaccine, they're now asserting that vaccines are rushed, not tested for safety, and they have a list of grievances against, for instance, the mRNA vaccines. And if you notice, one of the things they do is, they just copy pasted the fake assertions on the HPV vaccine around infertility and autoimmunity and just glommed it onto mRNA vaccines. And so they could be pretty lazy, but very effective nonetheless. And so now we've got new studies showing that the Republican Party is now the major purveyor of anti-science activities. And this is kind of weird because before it was kind of a fringe element of the Republican Party and the Tea Party, and now it's really become quite front and center as a major platform. And you've got Tucker Carlson going on rants against vaccines on Fox News. And you've even got think tanks now that are funded to promote anti-science viewpoints, like the Hoover Institution at Stanford or the American Institute for Enterprise Research at Great Barrington. It's really taken this very dark turn. And the other piece to this is they've been also targeting specific ethnic groups like the Somali immigrant community in Minnesota, Orthodox Jewish groups in New York, and now they've been targeting the African American community, staging these rallies in Harlem and claiming and making terrible assertions about the Pfizer BioNTech vaccine and a new documentary linking it to Tuskegee experimentation. This is really getting pretty rough. And now it's globalized as well. So over the last summer, that same the same anti-vaccine groups and anti-science groups then were participated in mass rallies in London and Trafalgar Square and Berlin and Paris, and the New York Times and the BBC reported links to QAnon and political extremism on the far right. And now the Russian government is exploiting this. And the Putin government is, according to US and British intelligence, has launched this whole system of weaponized health communication. That's the term they're using to help promote this. So now we've got a real problem on our hands with this very globalized anti-science movement. And I have a new paper that just came out called The Anti-Science Kills, which you can download on the internet. So that's kind of the big picture. I know it's covered a lot of ground in a short period of time, but happy to hear your thoughts and answer questions however you'd like to proceed.
Thank you so much, sir. I know there's one, our first question was quite related, which is, what do you think the role of social media has been in this kind of anti-science or health freedom movement?
Well, that's it. I mean, it turns out when you go back to the history, and I have a paper on the health freedom movement because it goes back to the times of Andrew Jackson, and I think the difference between then and now is now we've got the internet, and now we've got all those social media platforms, and that has a huge amplifying effect, and it's very effective. And not only just social media, the e-commerce sites. I mean, if you go to Amazon.com and you go to the books on vaccinations, they're all fake anti-vaccine books, anti-vaccine, anti-COVID conspiracy books. So Amazon is the leading purveyor of fake anti-science and misinformation. So this, how you bring this all back is a big question. I've been advocating with the Biden administration to create an interagency task force around this to see how we can kind of bring this back and either take down some of the anti-science content or address it in some other way.
What do you see? What strategies work? Like, what sort of incentivizing strategies work for the vaccine? Or are there sort of punishments? So one question asked about a carrot or a stick strategy to get to herd immunity.
Yeah, I mean, this is so one of the things that I've been doing. Initially, because of the targeting, the vaccine hesitancy in the African American community was quite high, and I started going on a lot of talk radio shows and podcasts that reach Black audiences, and and a number of us have been doing that, and that's been partially effective. They didn't have access to real knowledge, and they were so inundated and flooded with the misinformation that once they heard from mainstream scientists, they got it right. It was, and now those vaccine hesitancy rates are going down, not as good as it should be, but much better than it was. The problem that we're facing now is from the political right, where this is seen as a test of their allegiance to the political right and being defiant of masks and social distancing. I mean, you heard Senator Rand Paul yesterday, get into it with Tony Fauci. I mean, this is it's become very tribal, and how you delink it is really tough. And this was a big problem when I was going on, CNN and MSNBC last year, and back around this time last year, that's when Trump started the disinformation campaign, claiming that that COVID was a hoax, and that COVID deaths were due to other causes, and discrediting masks and social distancing, and saying it was like the flu and it's going to go away, and spectacularizing hydroxychloroquine. Because I've been going up against anti-vaccine groups all these years, I'd become a bit of an expert on disinformation campaigns, and I was one of the first to call it out because I'd had that I had that experience. I can smell an anti-science disinformation campaign a mile away, and that was tough, calling it out because as scientists you're told stick with the science. You're not supposed to go into the political realm. Well, it wasn't so much that I was going into the political realm, but in order to disengage it, I had from the politics, I had to call it out, and that was a very dark time, back in March and April and May last year. And then they brought in Scott Atlas and all the other craziness, and then it was just a full on. And then Peter Navarro and Larry Kudlow were all amplifying these anti-science messages, and this was a tough time.
What do you think? Why do you think it spread so effectively? Like, what is the benefit? What is so great about the anti-science movement that people sort of capture it, glom onto it, that it works?
I think somehow it just became part of a tribal allegiance. And one of the things that I point out is, the Republican Party was never anti-science, right? The National Academy of Sciences was started in the Lincoln administration. Eisenhower launched NASA. George W. Bush launched PEPFAR, the President's Emergency Plan for AIDS Relief. This is all new, and somehow uh, the anti-science, anti-vaccine groups got the Republican Tea Party to adopt it as a core platform with catastrophic consequences, and that's been continuing as well. And how we extricate it out of there is something that I've been talking to a number of leaders in the Republican Party about, how we sort of bring some sanity back into this. Um, but but so far there's not been a lot of appetite for that.
Lauren asks, since you're speaking to a bunch of artists and arts administrators through the Houston Arts Alliance, what are your thoughts on how the arts can help with, to fight anti-science or to distribute scientific facts?
Well, art is so powerful, right? I mean, I think that's a great question, and I guess coming here, I should have thought about it more ahead of time. But I think that would be really interesting to do, kind of an exhibit of some sorts. Let me show you something which is kind of cool. There's this
Sure.
guy. I should have. Wait, what happened here? You still with me?
Yeah, we're here.
There you go. You still with me?
Yes.
Okay. Let me show you something which is kind of neat. This is a lecture I gave earlier. Oh, here it is. So you see these images on the right?
Mm-hmm. Yeah.
There's a very well-known photographer, Sebastião Salgado from Brazil, who spent months going all around the world photographing kids getting their vaccinations. Um, and I first saw this as an exhibit at the Pan American Health Organization, and mostly polio vaccine. And I love it because you see the full range of human emotion on the parents' face around
Mm-hmm.
kids getting vaccinated. So I think these are very powerful images, and I wonder if something along those lines, or using art can reach people in so many ways that I could never hope to do. So doing something around vaccinations would be kind of a cool exhibit to organize. A call, I guess you would do that.
Yeah, or it creates a real pathos around the event, a sort of human and trusting kind of
Right,
feeling.
right.
Yeah, that's great. Thank you so much. Let's dive a little bit into the facts about the vaccine itself.
Also, let me just say this. I would imagine, I'm still waiting, but I'm sure it's out there. I just haven't seen it. It's, the trauma of this whole last 14 months. Eventually that's going to be expressed, in literature, and it's already starting to come out a little bit, but I would imagine in various artistic mediums, it's going to be huge, right? I mean,
Yeah.
And that's going to be extremely powerful as well.
Yeah, we saw a similar wave after Harvey for a couple of years. There was a lot of grant applications that were flood, water, loss, storm related. Yeah,
Yeah, I
you're
mean,
absolutely
people,
right.
even after we all get vaccinated, get our way out of this, the emotional scarring and trauma is going to be huge on the
Yeah.
American people. And and arts, I think, could have a tremendous healing power of that, and that's going to be really
Yeah,
critical, I
there's
think.
the disaster program at HAA has tracked significant rates of isolation, anxiety, depression, and along with the rest of the mental health establishment around the country. Yeah. Well, let's dive into some of the facts about the vaccine that a lot of questions that a lot of people have. So we received one, and I've got many more for you. Have there been any deaths associated with or caused by the vaccine?
No, not that we know of. And what happens is, the vaccines be given to older populations, and older populations, have a certain attrition rate from losing their lives from age and other complicated illnesses. And the problem is, anytime a high profile individual who's over the age of 60 loses their life, the anti-vaccine groups want to ascribe it to getting vaccinated.
Mm,
And the most celebrated one was Hank Aaron, who died a couple of weeks after getting vaccinated, not unrelated to the vaccine. But that's what's portrayed a lot. There are severe anaphylactic reactions that can occur from getting the mRNA vaccines,
mm,
and they do happen at a slightly higher frequency than the influenza vaccination. So the influenza vaccinations are about 1 to 2 per million. Um, this one is as high as 2 to 11 per million. A couple of times higher than the flu vaccination anaphylactic reactions, but still a rare event. And
mm.
and that needs to be emphasized. And unfortunately, the communication around these vaccines is not strong, and and that makes it problematic as well. We don't really have a good system of health communication. I mean, and I don't like the way the U.S. government does our health communications. If you've ever seen the press briefings, it looks like some sort of dystopian version of Hollywood Squares. You've got,
No.
the, Rochelle Walensky, the CDC director, and Tony Fauci in these weird little boxes with dark backgrounds and ghostly lighting. I mean, it looks like you're being briefed by Kim Jong Un. I mean, it's
Yeah,
it's
yeah,
it's just
that's not
it's
the
just
vibe you want.
I don't know what they were thinking. I mean, but
Yeah,
it's so that doesn't help any either. I mean, even
yeah,
though what they actually say is fine, I just think the whole effect is pretty devastating.
yeah. Speak a little bit about what else vaccines might be good for. So, are there other illnesses? Is this technology, now that it's online and getting into people's bodies, is it going to have another health effect that aside from COVID?
Well, I think what you'll see is that same technology. We have an mRNA program in our group that we're looking at for Chagas disease vaccines and others. So I think you will see that technology used for some of these diseases. One of the things that I am worried about is the mRNA technology, as great as it uh, is still hard to scale up and produce, and it has that onerous freezer requirements. Eventually, that technology will improve and be easier, but for now it's not, and I don't think that's going to have a big role in, for instance, in sub-Saharan Africa. So Pfizer BioNTech made a big deal that they are shipping 230,000 doses of their vaccine to Rwanda, and that's great that they're doing it, but look at the real scale. I mean, sub-Saharan Africa is a population of 1.1 billion people. 2 doses of vaccine, that's 2 billion immunizations. We need simple, durable vaccines that we can accelerate now. So we're hoping ours will come in and have that role, because I'm worried about what's going to happen in Africa in the coming months now.
Yeah. And what is the image of health equity here in the United States regarding the vaccine? We understand there have been some news reports that folks of color and lower income communities have not had the access that sometimes they were even promised by public officials.
Yeah, I mean, this was a big problem when we first started, because we thought Operation Warp Speed had a plan for vaccinating the American people. It turned out all that, that four-star general who was in charge of logistics. Logistics meant, getting those things in boxes and put on the back of FedEx and UPS trucks and planes. And then it was adios. It was up to the states to figure it out. And the states didn't have the bandwidth to know how to do this, just like they didn't have the bandwidth to know how to do the diagnostic testing or the epidemiology control. There was this failed strategy that the states had to be in front, and that never worked. So now the Biden administration's come in and looked at this and said, the whole way of giving these adult vaccinations was through the pharmacy chains and the hospital chains. And, when you go to the HEB website, it's a great website. And I think they're doing the best job they can. They're actually doing a good job, as well as the other pharmacy chains. But guess what? When you go into the Fifth Ward in Houston, or a lot of the low-income neighborhoods, there's not an HEB on every corner, or a CVS or a Rite Aid. So these are pharmacy deserts, and nobody thought that you had to make vaccination sites accessible. And now they're playing catch up, trying to figure this out, and they're doing it. I think, and it depends. Here in Houston, the Mayor Turner and the county judge Hidalgo have done a good job trying to build out accessible sites, but it's tough to build in an infrastructure. As I say in my moments of cynicism, we don't really have a health system here in the United States. We have something called Amazon Pharmacy, and it's not adequate for something like this. So we're still trying to figure it out. So we are doing much better, but there's still a lot of room for improvement.
Yeah, given what you know about this new distribution strategy, the Biden administration, the judge, et cetera, when do you think we can get back to work? When do you think theaters could be full, or opera houses could be full, or museums can be full again?
I think by the summer, given the fact that the vaccines have such a good performance in reducing transmission. So, the CDC came out with interim guidance on what you can do after you're vaccinated. And a lot of people were quite critical of it, saying, what's the point of being vaccinated if you can't do X, Y, and Z? And I think this is just an interim guidance until they understand the full performance features of the vaccine. But I think, as we get over half the U.S. population vaccinated, you're going to start to see this liberalize more and more. And my hope is by the summer, we can, have ball games and concerts and theater again. And certainly by the fall, unless something really weird happens with the variants, which the UK variant we know is going to accelerate, but we're going to hopefully vaccinate ahead of it and the vaccines work. Unless some really bizarre mutant under the South African really takes off, I think certainly by the fall, we could have a good fall theater season and everything else.
That's great to hear. Thank you so much. And what about the South African variant? Why aren't we more afraid of that sort of taking over and beating out the vaccine?
So it's a good question. I was on an NIH. We're part of this NIH vaccination group, and we invited Trevor Bedford, who's one of the big virus genomics evolutionary experts, to our meeting. He's at the Fred Hutchinson Cancer Center, and I asked him that question essentially. We're all talking about the UK variant, but what happens now that we've got the South African variant here in Houston as well as the Brazil variant? He seems to be of the opinion that it's the UK one that seems to be accelerating the most right now, and those may become factors later on, maybe by next year, but not now. It's all going to be the UK variant, and some of the local variants that we have now. There's one coming out in New York and California, but those will be the dominant ones.
Okay. So there is a question, and the boosters might become very important.
That's right. That's right. And so there's going to have to be a lot of situational awareness in terms of what's going on.
Is there any reason whatsoever to prefer one vaccine over the other? Is there any difference between them in a material way that we should be aware of?
When I say no, take whatever you can get, because as long as you wait, you risk getting COVID, and especially now with this UK variant. And they all work by inducing virus neutralizing antibodies. They're all going to require boosters later on. We don't know the durability of protection for any of them. So my advice has always been get what you can. Okay. And don't overthink it. Don't try to game the system. Don't cherry pick. Just get what you can.
And does it matter whether you've had COVID before or not had COVID regarding getting the vaccine, not getting it, which one you get?
I think if you've had COVID, you should certainly still get the vaccine because the durability of protection is not that is very very variable. Some people are will be protected against reinfection for years, others for
Mm,
weeks, and you really don't know where you fall, and you'll get a big boosting effect from that first dose of vaccine.
mm,
The scientific community, certain elements of scientific community are saying, in fact, if you're already infected and recovered, that's almost like getting the first dose of the vaccine. And so by getting a single dose of the Moderna or Pfizer, which is a 2-dose vaccine, just by getting one dose, you'll get the same effect. Therefore, we can conserve vaccine by only giving those individuals one dose. And I agree that's true. And the French are trying to pursue this. The problem is, I don't think we have a health system in place to operationalize it because it requires you to confirm previous infection by doing an antibody test, having a reliable antibody test, and by the time you do it all, it's just easier to go ahead and give the regular vaccine regimen.
okay.
So France is pushing hard on this, and they have a much better public health system infrastructure than we have in the United States, and they're struggling with it. So I don't see how we operationalize it.
Gotcha. And how long after each of the vaccines do you have to wait before you can resume some sense of normal activity?
I probably within 2 weeks. Sometime 2 weeks after your last immunization,
Okay.
you should be good.
And what can you do? So you hit that you got 2 shots of your Moderna, your Pfizer, one of your Johnson Johnson. You wait 2 weeks. What are we safe to go back to? What should we go back to doing?
You should be you're as protected as you'll ever be. And this is, we're going to have a frank dialogue with the American people because the risk is never going to get to zero.
Mm,
And so if you can't tolerate any risk at all, you're still going to be pretty confined to what you're doing. So for now, the CDC is gradually lifting restrictions on people who are vaccinated. They're saying that you can now go be indoors with another group of people who are also vaccinated. Your risk of transmission is nothing, basically,
mm,
very little. And now they're saying also if you're a grandparent or parent who's been vaccinated and you want to see your kids or grandkids, if it's in a single household, even though they're not vaccinated, that should be okay. And I'm glad they did that. But they're still saying on restaurants and travel and that sort of thing. And some people were pretty upset with CDC. They're saying, if you're saying, what's the point of being vaccinated? You have to get back to it, back to life
mm,
eventually. And I think just the CDC needs to buy more time to understand better the full performance of the vaccination. So eventually, I think we'll get to a place where if you're vaccinated, you shouldn't have any restrictions on what you do. Um,
gotcha.
and I think we're going to move towards that. They're just not ready to blow it open at this point. And I think what they want to see is a higher percentage of the population get vaccinated because then the level of transmission is going to go way down.
Mm,
So we're still, even though things have declined, we still have a pretty high level of transmission and we have that B117 variant. So I think it's to buy time till we get a higher percentage of the American people vaccinated and to get that B117 variant under wraps a little bit more.
It's interesting to consider the risk of the variants, the fact that we'll need a booster, but coupled with the fact that once you get vaccinated, you'll never be more protected, and the growing evidence that vaccinated people cannot transmit the virus, meaning
Right.
they could be in a room with unvaccinated people and they are not a risk to any of those individuals. So that's
Right.
really interesting
That's
balancing.
right. And again, it's not zero. It's, we're looking at 90% reduction and that sort of thing. So, and this is one of the hard parts. Nothing is, black or white. We're
Yeah.
still dealing
And
with lots of shades of gray.
And I understand that there's a difference between what is sometimes quoted in the press, the effective rate of the vaccines, and the rates of reduced hospitalization and death. Can you talk us through what those rates are, like how they're different, et cetera, what matters in that data?
Yeah. So for instance, the J&J vaccine, the risk of getting symptomatic illness is reduced 72%, but the risk of severe illness is 86%. So, it's basically keeping you out of the hospital. So there is some variability there. And I think if you go to if you wind up doing a second dose of the J&J vaccine, it'll go up even more.
Okay. And then, and what are the rates of no severity of illness in Moderna and Pfizer?
Really high. I mean, well over 95%.
Great.
So, basically, if you've got 2 doses of the Moderna Pfizer vaccine, it's very unlikely you're ever going to, assuming unless there's some change, that you're going to wind up going to a hospital or ICU with
Right.
COVID-19.
So it's almost like it reduces your risk of COVID to like having a cold or something, like
In a
something
sense,
easy,
yeah,
manageable.
and yeah, that's right. That's right.
Okay, that's really powerful science. So let's see. If anybody's got any other questions, please put them in the Q&A. We have one that sort of gets at something you already said, Dr. Hotez. Like, what do you envision for vaccine passports or some other way to demonstrate to the world, like, I'm safe to be here?
Yeah, I mean, one of the interesting things is, when I've been reaching out to conservative groups because of the vaccine hesitancy, I've been going on to Newsmax and Fox News and that kind of thing. And what's really interesting is what's getting them so exercised and worried. And oftentimes it comes down to, and then the question comes about vaccine mandates. They're obsessed with this comes out of this health freedom business that the government's gonna, the army's gonna come in or the National Guard's gonna come and hold people down and force them to get vaccinated. I said, look, we don't even have the vaccines to even ask for mandates at this point, so I don't see this as a big factor. But this is a big concern. Um, and so, but if there are requirements, it's probably going to, I don't think it's going to come out of the public sector. I think it'll more come out of the business sector. So you're right. United Airlines at some point, to ensure safety of their passengers, may require you to get vaccinated in order to show proof of vaccination in order to get on a plane. More likely, and I think that's probably not, that may not happen, but what's more likely is as the world gets vaccinated, you're going to have to show proof of vaccination to enter the country. So, for instance, when I do a lot of work in Brazil, or have done a lot of work in Brazil, and I have to provide proof of yellow fever vaccination. It wouldn't surprise me if they required COVID vaccination. So having that may be important for your ability to travel internationally. Right now, I'm trying to minimize the importance of any mandatory vaccine requirements just because it promotes further vaccine hesitancy among conservative groups. The one other place I could see it, when my youngest son went off to college, he had to have proof of his meningococcal B and his meningococcal ACWY vaccination. Because if you're in the dorms and crowded dormitories, I could imagine as vaccine becomes available, colleges may require the kids to, if they're living on campus housing, to require vaccinations. That might be reasonable. As the vaccines get approved, because they're still released under emergency use, I could imagine the military may require it. So those are some of the kinds of things happening. But I think for now, treading lightly on the mandates.
Gotcha. Do you have any tips for those who are seeking the vaccine but maybe struggling to find an appointment?
We've all been reading about how the complexity and how difficult it's been. I think we are making our way through it all. Getting onto the whatever the websites are and getting your name out there is going to be really critical.
Gotcha.
And more vaccines going to become available.
Gotcha. Yeah, right. As the Biden administration is promising that it'll be
Right.
distributed to states by May, I understand. Well, Dr. Hotez, we're just about at our time. Are there any final thoughts you want to share with us? We are so grateful for you lending your considerable expertise to this arts community in Houston. We're grateful for your support. Any last thoughts for us?
Well, my last thoughts are, one of the things that I've been doing going on CNN and MSNBC is I wind up telling people a little bit about Texas and about Houston. And, um, we don't have the best reputation nationally. This concept of flyover nation that media is mostly concerned what's going on in the Acela corridor in San Francisco and everything in between. And so I always use those opportunities to tell people a little bit about Houston, and I write and talk about my neighborhood in Montrose, and what an incredible arty place Houston is, and its commitment to the arts. And in my latest book, Preventing the Next Pandemic, the last chapter is called The Broken Obelisk. It's about, Ann and I often take walks, but we live not too far from the Menil, so we'll take walks along the Menil and the Rothko Chapel, and I'm always very inspired by that Barnett Newman metal sculpture, the Broken Obelisk, and what it means, and I think that message could get out more. When I think about what's, because a lot of people now are moving to Austin because it's high tech, and I say, well, Houston has some great things going for it as well. Of course, the oil and gas industry and the Texas Medical Center and NASA. But the other thing I say is the two things are the food and the arts. This is, it's just incredible. I find this a very artistic kind of place, and you meet a lot of people committed to the arts. And if I were king of Houston, what I would be doing is building out more art spaces. I would want to see, whole neighborhoods transform into places where, people can, have low cost access to places to practice what they're doing. And because to me, what goes on in the arts here is extremely inspirational, and love everything that's going on. It's one, it's funny, when I took a job here at Texas 10 years ago. I came to the Texas Medical Center, Texas Children's in Baylor. And I thought, I'm going to love the Medical Center Houston. I don't know. Turns out, the politics of the medical center I could do without sometimes. But we love Houston. We love. It's just such a cool city, and it's got such a great vibe. And just thanking everybody for that kind of inspiration.
Absolutely. Well, the arts appreciate you too, Dr. Hotez. Thank you for your time today, everyone. This recording will be made available on our YouTube page. We'll send it out in our newsletter and on our social media channels. Thank you for joining us, Dr. Hotez. Thank you so much. Check us out at haatx.com for more information about our grants, our disaster services, our public art program, etc. Have a great weekend, everybody. Thank you, Dr. Hotez. Keep up the great work, sir. We need you.
Thank you so much.
Bye-bye.
Bye-bye.